Okay, Dr. Buford, we're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And the first thing we usually identify is the long head of the biceps tendon. It's kind of hard because you can see all this torn tissue. And some of this looks like it's rotator cuff, right? Look over here. So this rotator cuff is definitely frayed. Not sure if we're going to have to repair it yet, but we're going to start just by trimming some of the frayed edges so we can really get a good picture of exactly what the injury is here. Okay. And then the biceps tendon, as we expected, is loose and torn here. So we are going to do that biceps tenodesis that we talked about in the office. And then you've got some changes in the cartilage here on the humeral head. You can see there as well. So in these sorts of situations, the first thing that we do is really the biceps tendon. And now we're getting a pretty good idea of what's going on with the rotator cuff there. We may just put a hi-fi suture across that, but we'll make that decision a little bit later. Now, as they get things ready to go for this biceps, we're going to look around the rest of the joint. This is the posterior shoulder. This actually looks pretty good. The glenoid, which is the socket down below, looks pretty good here. And as we look down the front of the shoulder, I don't see any problems down the front either. We can look a little bit closer at that, but that looks pretty good. So the next step right now is going to be to take a spinal needle and pass that through the biceps tendon. So with a little bit of luck, you'll see that needle right there come right through the tendon. There it is. That's our first pass. We'll go ahead and take a nylon-coated wire called a super shuttle. Pass that down through the needle. And then we'll grab that with this instrument you see here. You got the camera? We'll back the needle out. And now we're going to load this with a suture. And this is kind of the first stage of reattaching this biceps in a different part of the shoulder. Okay, and so now we're going to do that same thing one more time. We'll pass right through the biceps tendon again, maybe a little bit higher. There we go there. I like that. We'll go ahead and pass the super shuttle through. Do you have another free hi-fi suture? You already have it open? All right, so we're going to go, let me get the grasper. So we're going to take the grasper one more time. Back the needle out. And now here's the trick for what we're going to do. We're going to reach around behind the biceps. That's something we didn't do the first time. And then we're going to now we'll grab the relay here. This is going to give us a stronger suture around the tendon. So after we pass this here, we're going to take a pair of scissors and cut the tendon. There it is going through. So what you'll see in just a minute is a loop going around the tendon. Okay, so now we've got that loop around the biceps. We're going to go ahead and cut the biceps at its insertion here. So what you see here, that instrument, that's a pair of scissors. We just come across the base of the biceps here and release it. And there the biceps is released. We have a good hold on it now. And now we can use our shaver to smooth out some of these edges. primarily on the labrum down below, but actually the labrum already looks pretty good there. So the next step, we're going to take a spinal needle and another hi-fi suture and pass a marker stitch that's also going to function as a ripstop stitch across this rotator cuff tear. Pause. Okay, so the biceps tendon's right there. We don't want to expose it too much. You just want to expose enough of the bone, enough of the tendon to make sure we're getting this reattached right down to bone. That looks like a pretty good spot. For reference, there's our subacromial space. And so we're going to tack this down right next to the biceps. Right about here. Pause. Okay, so we're all done. There's the final look for the tenodesis. Okay. There's the decompression at the top of the screen. And we even tied that stitch for the rotator cuff, which did not have a bursal-sided tear. So we're all done. Good luck to you now. Bye-bye.